Hello, good evening, everybody. Meeting again for the Materia Medica session. And yesterday we have started with this discussion at 9:30. We have started with the introduction to the Materia Medica, why it is necessary to understand Materia Medica, the depth of understanding the Materia Medica, and how to recollect the Materia Medica when we are learning. It is quite possible that we get confused and we forget many things while learning the Materia Medica. Allen's is the best book to learn and keep everything in mind. It is the best work done by H.C. Allen, and the kids really they are the kids in the remembering the Materia Medica, and that's why this Materia Medica, if you make a hold right from the start, then definitely it helps you in practice. It is not only for the purpose of examination, but at the for the purpose of really in the practice. This is the Materia Medica which helps you a lot. Every sentence, if you understand properly, then you will get this Materia Medica in your brain properly. So yesterday we have discussed about the Allium Sipa. I told you that I will start with the A series, but what I thought that when we study with a comparative study, we never forget the things because analysis is always done with by comparison. Our mind is a logical mind. Human mind thinks logically, and logic always compares. Logic analyzes and compares, and because of analysis and comparison, we remember many things. So when we learn LMCPA, the closed comparative remedy is the Euphrasia, exact with opposite polarities. And that's why if we learn these two remedies together, we never forget about this. And that's why I have decided it is better to go with the Euphrasia today instead of a remedy from A group. So today we're going to learn about the Euphrasia. Before going into the Allen's keynotes, I want to share two important cases, very important in fact in my practice, because one day one young fellow nearly about 16 17 years of age came into my OPD, and he sat in front of me and he was coughing, continuous cough was there, and there was a lot of watering from the eyes as if he is weeping. So I asked, what has happened, dear friend Vedant? His name was Vedant. What has happened, Vedant? Why do you are weeping? Doctor, I'm not weeping. This is what happening since yesterday. So he said, whole day yesterday I coughed so much, but luckily enough, whole night I slept well. And when today morning I wake up, it has started again. And again there is a watering from the eyes and continuous cough is there. And this watering, everyone is asking me why you are weeping. So much of profuse watering from the eyes with a lot of cough, lot of paroxysms of a cough, and aggravated only during daytime. Modality was very important. Modality was aggravation during daytime, whole night he slept well. This is too important. If the cough is better when during sleep and aggravated during daytime, associated with profuse lacrimation, no other remedy came into my mind. And I saw the instantaneous result of Euphrasia on that day when I prescribed him Euphrasia 203 doses and asked him to sit for a half an hour over there. I want to see what happens. After 15 minutes, he entered. Doctor, I'm feeling too much good. So I observed him and really the watering has stopped. It is the remedy which has the same pace as Allium Sipa is having the pace. So acute in action, so acute. So it worked beautifully and immediately it has stopped. Once it has been stopped, I asked him to meet me next day. He came next day and he said, whole night I was good, but little bit again cough is there since morning. So I asked him, what has happened? He said, nothing. Everything was fine. Everything was going on in a fine direction. Nothing. So I slept also well. But since morning, I'm having again little bit cough. So I said, what to do? I asked him, we'll repeat 3 more doses and just see what happens. And next day, again he got. And then it has completely stopped. Euphrasia is the remedy in such acute cases. Like LMCPA is the remedy. Yesterday, I forgot to explain one thing. There was one sentence, but I forgot to explain. In LMCPA, there is a one sentence was there in the remedy that there is a headache which has been mentioned in LMCPA. Just a minute, I will open the LMCPA and I will let you know that sentence. And spring coryza after damp northeasterly winds. We have not talked about this. What is northeasterly winds? We have learned the geography. And when we were learning geography, we have learned all those things that mm, west winds, south winds, eastern winds, northeasterly winds. At that time, we have learned just for the aspect of getting through that. But it has been not considered at that time that this will help us in future while practicing. Question arises. One student asked me, how do you know this is northeasterly winds? You have to go out, find it out your position where you are. If you are regular doing exercises, walking, or you are doing cycling, and you know the positions in which direction you are going, immediately you catch what type of winds are flowing. Whether the wind is coming from your eastern side, because I used to go to the north, that is my regular route. Immediately I catch today what type of winds are there, whether it is from east side, from south side, from north side, because it automatically reflects in your actions. That is a big way with which you can understand that. Northeasterly in Marathi, Ishanyaware, we can call it northeasterly. And these are the things which aggravates the LMCPA. Exactly in Euphrasia, there are south winds which aggravates the problem of Euphrasia. And these things are also important modalities one should not forget. Yesterday we have learned about the season classification. So we have learned the exactly what do you mean by the spring season? What do you mean by the autumn? What do you mean by winter, summer? Exact European seasons, and we have classified them. In the similar manner, we have to look towards this specific thing that we have to catch those south winds, northeasterly winds, western winds, or not, or you can say that north winds, and all those modalities are given in our Madhya Medica. Second case which I have to share was a very simple case, and it is a keynote of the Euphrasia which was present. There was a young lady, she came to me and she said, Doctor, I have very scanty menses. Since long time, I used to bleed for an hour only. And that's one day I have to utilize pad, nothing else. And it happens 1 or 2 hours and then finishes, nothing happens thereafter. And this is since last 3-4 years, this is happening. This is one more keynote of the Euphrasia, that menses appears for only 1 hour or one day. That is the characteristic of Euphrasia. I prescribed Euphrasia to confirm the Euphrasia, and Euphrasia worked. She started getting the menses and she used to pass the blood 3 to 4 days. This is another very important remedy for oligomenorrhea. So we must correlate our Madhya Medica with the clinical terminologies. So much oligomenorrhea is present in Euphrasia. So these are the keynotes one should not forget regarding the Euphrasia. And third important feature, which we never consider Euphrasia because we keep in our mind only nasal and eye complaints with Euphrasia. I used to use this remedy whenever arnica fails in injury, blunt injury, whenever arnica fails in blunt injury, Euphrasia is a very good remedy for the mechanical injuries other than arnica. If arnica is not relieving the pain, the Euphrasia is one important remedy one should not forget, because blunt trauma, Euphrasia plays a very vital role. So let us go with the Allen's keynotes. What he says, it is very short remedy. Only one page is given by Allen, but every sentence from it is very important. The common name is eyebright and family is Cropilaceae. First sentence only, he starts directly with bad effects from falls, contusions, or mechanical injuries of the external parts. And here it comes close to the arnica. What is the difference there? Basically, whenever arnica is there, you get the petechial hemorrhages, what is called as ecchymosis. Whenever blunt trauma associated with ecchymosis is there, with a sore bruised feeling, that's a specific sensation, sore bruised feeling, that is as if it has been very severely paining. That typical feature is there with the arnica. Arnica is a very good remedy to absorb that hemangioma. If there is a black eye, this is a good remedy to absorb the hemangioma. Here, when the pains are there, mechanical injuries are there, contusions are there, but not that specific sore bruised feeling of arnica, not that petechial hemorrhage of arnica, Euphrasia is the remedy. This is the basic difference between these two remedies. Second sentence is very close to the LMCPA, catarrhal affections of mucous membrane, especially of the eyes and nose, and here it is very close to the LMCPA, only the modalities are different and the characteristics are different. Profuse acrid lacrimation with profuse bland coryza. Discharges from the nose, discharges from the eyes, both are profuse. Maximum quantity, as if someone is weeping. But lacrimation is acrid and coryza is bland. When we learn LMCPA, lacrimation is bland and coryza is acrid. Exactly opposite is there in LMCPA. And here these are the things which comes opposite to each other. The eyes water all the time. See the sentence, eyes water all the time and are agglutinated in the morning. Margins of lids red, swollen, burning. See, eyes are watering, it is full of water. Sometimes it looks conjunctivitis, but conjunctivitis, when profuse lacrimation is there, then Euphrasia plays the role. Conjunctivitis with lot of agglutination, yellowish discharge, itching, irritation, one can think of argentum nitricum. There is lacrimation is not that profuse, which is there in Euphrasia. So when we think about the remedy, always compare the exact symptoms, what happens over there. So in Euphrasia, lot of watering, continuously watering is there. Margins of the lids, the eyelids margins, they are swollen, red, and they burns. And that's why patient tries to rub them. Profuse fluent coryza in the morning with violent cough and abundant expectoration. So coryza associated with cough, with lot of expectoration, aggravated from exposure to warm south winds. See, this is what underline. Warm south winds. Aggravated from warm south winds. In LMCPA, coryza is aggravated inside the room, ameliorated in open air. Here it is not so. Here it is aggravated in the evening, in the bed, indoors, warm moisture, after exposure to south winds, wind touch. These are the modalities. Better in open air is not the characteristic of Euphrasia, which is there in LMCPA, pulsatilla. So profuse fluent coryza in the morning with violent cough and abundant expectoration, aggravated from exposure to warm south winds. Concept of south winds, keep it in your mind. You have to find it out. If you are, even if you can go on terrace and just observe the kites over there, if the kites are there, in which direction they are going. If they are going toward the eastern side, definitely it is the western winds. If it is going in north direction, it means south winds are there. Only thing is that you have to logically understand which type of specifically winds are blowing, so that you can catch it is very easily. When attempting to clear the throat, this sentence is very, very, very important. It is very close to bryonia, very close. When attempting to clear the throat of an offensive mucus in the morning, so patient have capacity, patient have many times the addiction that they put the fingers inside mouth to remove the cup, and when they tries that, gagging until it vomits the breakfast just eaten. This is the thing which happens like bryony. So it as a cup, while removing the cup, the vomiting happens. Specifically in the morning, if it happens, along with the bryonia. This is one remedy, but bryonia basically has a typical dryness over there. Bryonia is having associated with typical thirst for large quantities of water at long intervals. Bryonia, you can get that pain associated with while cupping, and he holds the chest over there. In a study, we have learned that Allium Sipa, when he cups, keeps the hands in his lower larynx. So you observe, make a habit of observing how the person is cupping. This is too important. Hahnemann have said that there are four important qualities the homeopath should born when he takes the case. Specifically, if it is chronic, then those are very important. First quality he has mentioned, freedom from prejudice. That is most important. Second, he explains the sound senses. The third he mentions attention in observing, and you should attain that. And fourth is fidelity in tracing the picture of disease. So you should be very good observer. You should have very good ears. You should catch if the patient is sitting over there outside in your OPD and he was cupping, and he was cupping like that. He's cupping like that. Patient is not in front of you. Patient is in the waiting room and he's cupping. If your senses are sound, you get the remedy. You just observe the patient. For the sake of patient, write it down, check him, but your remedy is fixed in your mind. What is the remedy? Remedy is calcarea cough. Yes. Single paroxysm. So you keep those things. If patient is coughing like that, this is two paroxysms in succession. Only 3-4 remedies: Muxol, Belladonna, Merxel. So you can catch that. You just observe what is happening over there. In this, how the patient coughs, what he do. He says, doctor, when I put I want to remove the cup, vomiting happens. Think of Euphrasia, bryonia. These are very important remedy. Profuse expectoration. This is one important thing. Every time, it is not just dry cup. Profuse expectoration of mucus by voluntary hawking. Voluntary hawking. He coughs and he starts coughing, and he tries to throw it away. Aggravated on rising in the morning. All modalities gets aggravated in the morning in Euphrasia. Whether it is cough, whether it is coryza, everything happens to be there in the morning. Profuse expectoration of mucus by voluntary hawking aggravated in the rising in the morning. Amenorrhea. See, this is one feature one should not forget. Amenorrhea with catarrhal symptoms of eyes and nose, profuse acrid lacrimation. This is a trio. When such a thing is mentioned, it explains you the state of the patient. Patient comes to you for amenorrhea, and along with amenorrhea, if there is a coryza and lacrimation, and profuse lacrimation is there associated with that, with a catarrhal symptoms, think of Euphrasia. So whenever Allen have mentioned two important symptoms in relation with each other, it indicates the state of that person. That is the state, very specifically. And state consists of two or three symptoms which defines that state of that specific person. So amenorrhea with catarrhal symptoms of eyes and nose, profuse acrid lacrimation, and C, menses very characteristically, he has written in bold. Menses are painful, regular, now lasting only 1 hour. See, this is written in bold. Or late, scanty, short, lasting only 1 day, like Barata. So this is one more remedy, Barata cup, where you can get such a feature. Menses lasting only 1 day, but Barata is a very deep acting remedy. Barata is slow in action. Barata has a very deep pronounced action. If you open the Borix Remedica, the Euphrasia is only short acting, 7 days action is there. Barata is 30, 40 days, 50 days acts. It is so constitutional remedy. So there is a difference. Here the patient comes in acute state. It is, yes, doctor, last 2, 3 cycles, this is what is happening. Barata, everything is dwarfishness. Everything is slow. Dullness, sluggishness, late, indolence, everything is Barata, defines the Barata state. So you can easily compare these two things. Pertussis. Pertussis is very important. Pertussis means where excessive lacrimation during the cough. Tremendous lacrimation during cough. While coughing, there is tremendous lacrimation, lot of watering from the eyes. Cough only in daytime. Ferrum metallicum, natrum muriaticum. Two more remedies mentioned by him. And this is what I have explained in that case of cough. The patient came to me, Vedan, and he very easily settled because of that. Pertussis is in Marathi, we call it Dangya Kokla. This is very typical and it starts right from the throat only. And it is whooping cough, very severe type of whooping cough is there. So this Euphrasia is one of the important remedy for cough when there is a profuse expectoration along with the lot of lacrimation. So it comes in state where you can get the cough, daytime, profuse lacrimation, profuse expectoration, vomiting when one has to hawk and remove the cough. So this is Euphrasia cough. And then relations. Never forget the relationship because relationship always guides you exactly. Similar to pulsatilla in the affections of eyes. What is it? Similar to the pulsatilla in the affections of eyes. Very, very similar. Pulsatilla. Because watering from the eyes, redness of eyes, conjunctivitis, but in pulsatilla, along with the lacrimation, pulsatilla discharges are yellowish in color. Pulsatilla is the remedy which is subacute in action. Subacute inflammation is covered with pulsatilla. Acute inflammation is covered with Euphrasia, Alimsipa, whereas in pulsatilla it is subacute. Pulsatilla is always close relationship having the Kali muriaticum and Kali sulfuricum. They are the chemical analog of the pulsatilla. So pulsatilla is little bit late in the inflammatory stages, whereas in this Euphrasia it is very acute. Subacute means they are having action around between 20 to 30 days. The inflammation, if you know the inflammatory stages, the first stage is congestion, second stage is there is a fluid movement, the edema starts developing. So these are the stages with which you can understand the inflammation. You have to understand inflammation from pathology. If you understand that, then you can very easily catch that. Inflammatory stages always gives you very clear-cut idea about the remedies. If your pathology is clear, you can easily catch. Reverse of Alimsipa in lacrimation and coryza already discussed. Aggravation. Aggravation modalities are again important in the evening, in the bed, indoors, warmth, moisture, after exposure to south wind, and when touched. When touched is very important modality. When you touch immediately, the lacrimation starts, coryza starts, or sometimes cough starts. Heparsulf is very sensitive, aggravated by touch. Even ammonium carb is another remedy where touch aggravates the coryza. So Euphrasia is a very wonderful acute remedy from the Scrofulariaceae family, and one should not forget the Euphrasia. So Euphrasia is acute remedy having 7 days action, LMCPA around 1 to 7 days action. And both remedies we have to recollect when we compare them one with each other. And when we compare Euphrasia with pulsatilla, LMCPA with pulsatilla, then we'll make also fixed about the certain features about the pulsatilla in our mind. Make a habit of comparing the remedies. When you read over there in the Allen's notes one sentence and in bracket the remedies are given, open that chapter and see what is the exact similarity and what is the difference between them. If you read this Madhya Medica in this manner, you never forget. That is what is the analysis. You analyze and very easily compare one another, and that becomes fixed in your mind about the remedy. So this is what about the Euphrasia we have discussed today. Somewhat beyond acute, but not yet chronic, correct? That is what is called as a subacute state. In between state, acute and chronic is subacute state. Very correct. So this is what regarding the Euphrasia. My suggestion, read them again and again. Whenever you get bored, open the Allen's notes and read those remedies which you have already learned. So what happens when you read them again? They becomes fixed. It the way you have to recollect the Madhya Medica, you have to go through them again and again. Keep fixed in your mind regarding them. Then you never forget about the remedies. This is too important. You have to watch them again and again, all sentences, and then it becomes part and parcel of your life. That patient comes and you see a refresher is coming. You see and observe, yes, Alimsipa is coming. That much Matra Medica should be there in your mind. So many people have joined today. I'm very happy. Nearly about 83 students and practitioners were there for today's session. Dr. Dolly, Dr. Anita, then Dr. Satyanarayanji, Varke sir, many senior practitioners are there with us. Thanks to them for attending such a Matra Medica session. And it gives me a pleasure to discuss. Sir, tomorrow we'll discuss rainy season remedies. No, tomorrow we'll go again with the A series again. We'll go with the A remedy. And with A remedy, we'll compare if it is needed to be compared with other remedy. First, I will going to cover the remedies from second year BHMS syllabus, then third, then fourth, because the remedies which are very common in our practice, they are in second year and they are very useful for us. That's why we'll go by it. Aggravated by touch means it can be cold, air, warm, and physical, everything, every touch in every respect. It is physical touch as well as a sensational touch also. Yes, definitely.
Sir,
Yes.
sir, this is Dr. Utpal Palpal here, sir.
Yeah.
Sir, in Arnica, and when comparing with injury cases with Euphrasia, sir, and in case of Arnia, years ago, there is if there is the injury, we can use. But in that case, Arnica fails. Can you use, sir, Euphrasia?
Yes, definitely. But injury, you have to first find it out what type of injury is there. In Arnica, definitely the ecchymosis is always present. Petechial hemorrhages are quite common, and the typical pain of Arnica, sore breast feeling, then Arnica is the indicated remedy. You have to understand exactly what Arnica is. Arnica, once you understand, then you will not forget Arnica. Arnica, we keep only the injury in our mind regarding the Arnica. What we'll do, tomorrow we'll learn the Arnica. So once we learn the Arnica, you'll never forget the Arnica and Euphrasia comparison. Very easily you can compare. We'll do that thing tomorrow. Okay?
Okay, sir. Thank you.
Yeah.
Okay,
yes, Satyanarayana. I'm not getting your voice. Sir, your voice mic is off.
Sir, what is the use of knowing the number of days deep acting this thing? No, we are going to give the medicine. No, you are telling it will take 30 days. It will be acting. By knowing the number of days, what in what way it will be useful for us, or in how it will be applied?
Sir, basically, every remedy has its own basis. Aconite, if you open, aconite is very short acting remedy. Very short. Aconite will not make a action throughout. It is when acute remedy is there, acute remedy never penetrates to the depth of it. It never covers the miasm. Why Hahnemann came to the conclusion of miasms? When he was practicing with all those remedies, but he was not getting correct results because he was using the Naxwamika. He has mentioned in the it has been mentioned in the Robert as well as Kent, where he has mentioned that Hahnemann was not getting results with Naxwamika, Ipecac, because he was treating with those remedies which are short acting, which used to produce the palliation only. Because the miasmatic focus is not covered under that. The deep acting remedies, the constitutional remedies, penetrate to that level. They are, if you go with all constitutional remedies, you will find they are very deep acting. When they have proved, their symptoms appears to be there nearly about 1 month, 40 days, 50 days, 60 days. Last symptom collected was around 60 days. Then that remedy was having action nearly about 40 to 60 days. This is what written. This is a big work done by the Gibson Miller, because of which we know the at least actions of the remedies. So this is very important thing which he has made over there. If you see aconite, it has been, when it has been proved, it has showed symptoms for very few days, not even for 3-4 days. First day only, all symptoms, maximum provers have shown the futures, because it is a remedy which has that pace. But if you go with the Barata has very slow, insidious appearance of the symptoms. And that's why in the Borix Materia Medica, if you go with the dose part of the Barata, it has been directly written by Boric that it is very slow in action, bears repetition. These are the words by the Boric over there. So this is the reason, and Hahnemann came to the conclusion of this only because he was not getting the results with those acute remedies, and patients were suffering since long time. So when you have to treat a patient, you have to first differentiate whether it is acute or whether you are treating the chronic. If you are treating the acute and you are finding it out remedy chronic, very deep acting, it will not going to produce result immediately, because the pace of the disease is different and your remedy pace is different. The pace should match, then remedy works. And that's why Hahnemann have utilized one word, knowledge of medicinal powers. This word he has used. He has not mentioned over there knowledge of medicines. This is the difference.
Thank you, sir. Thank you, sir.
Okay. So thank you being there. We'll conclude today's session. Tomorrow we'll meet at the same time with Arnika. We'll definitely going to learn the Arnika in tomorrow's session, because I have many experience of using the Arnika in my practice, right from when I was there with my sir, Dr. Nitin Bagli sir. So I will share all those experiences in tomorrow's session. Okay. Thank you everyone being there, and it's wonderful time with all of you. Thanks a lot.